Tell me more about pickleball.
It's like tennis. All right, do you play tennis?
No.
Have you ever played ping pong?
Yes.
Can you imagine standing on a ping pong table with your paddle, but it's big like a half of a tennis court, and playing the game?
So you were very active.
Always.
Very active. What brought you here?
I'm dizzy and I'm not balanced. So I came here because Allison came to our retirement community, and I got on her little cushy disc or whatever, pillow, and I failed all the tests. And I failed all the balance tests, but I knew that I was going to fail them. I just didn't know I'd fail them that well.
And what did she say after that, after you failed?
You should come see me. And they said, do you take my insurance? I've had the problem for a long time, the dizziness, but not the balance problem. I've been really trying to think about this, and I think the bicycle accident I had 3 years ago affected my overall balance.
How does what you've had here compare to where you've been to other facilities?
You got rid of the crystals.
Okay, that's a big part
I don't
of it.
know if they'll come back again, and maybe things have changed, but what they told me was I was supposed to go home and do these maneuvers on my own bed or couch, or
Got it.
and that's not the case, because I could make it worse.
The other place they were having her, what she was saying earlier, they were having her self-treat. So they told her how to do a maneuver and told her to go home and do the maneuver. But the problem with that is if you're not doing the correct maneuver, because she doesn't know which canal the problem's in. So there's 3 canals. There's an anterior, posterior, and horizontal canal. We have technology called video nystagmography. We put goggles on and we look at your eyes and we can tell which canal the problem's in. And if you're doing one specific maneuver for the posterior canal, but the problem's not in the posterior canal, it's in the horizontal canal or the anterior canal, you can make the problem worse. So doing it at home isn't advisable. You need to come to someone who knows how to figure out where the problem is and how to treat it.
What would you
Age
say
group.
to somebody out there that doesn't know about this therapy?
Okay, there's a difference. If your problem is also tied in to a balance problem and the crystals, I think you're a more encompassing place to go to.
Okay.
I went to a balance center and they worked on, what is that called? That head thing? What's
The
that?
7-head position.
The 7 they did do the 7 head positions, and they had me doing some balancing things, but it wasn't as comprehensive as, and they didn't do the testing that you did.
Right. We have
So-
some really amazing technology to test that other places don't have.
Right, and it came back. So,
Right.
but not to say that the crystals won't come back, but I'll know what to do next time.
Exactly. You know where to come.
Well, thank you for
Yes, thank
Okay.
being here, for trusting us, because I remember when we first met you.
Well, if
And
you,
you said, I've been to too many places and nobody can help me.
That's right.
Well,
So we're glad that you at least took
I
the
tried
first
again.
step
Yeah.
to try.
well, the
So thank you.
motivation is, first of all, I know the balance can be improved without a problem, and I was willing to try again
Anything
one
to
more
get
time.
that dizziness to go
Yeah.
away, right?
All right?
Well, thank you so much.
You're welcome.
We
Thank you.
appreciate you.
Oh, you're welcome.
And as always,
If you have any dizziness or vertigo, please come to the Ear, Nose, and Throat Institute and let our family take care of yours.
Aw,
there you go.
that's nice.